Great. Just for those that have joined us just now, good morning, good evening, good afternoon to everyone, depending on which part of the world you are. Just to quick housekeeping issues, we do have Spanish interpretation as well for the webinar today. So if you probably require that, please just feel free to, um, you know, click right the button on interpretation right at the bottom of your screen, and you probably will have access to that. We will be kicking off in about 60 seconds, and we're really excited to have a team of experts and panelists who are going to be walking us through this interesting conversation today. Great. So thank you. I think we do have a sizable number of people that have joined through. We'll have a few others that will come in a little later on. Before I probably kick off with a few introductions, just to quickly highlight that, look, I would want to remind everyone that at the end of this webinar, we'll have a survey that we'll kindly request that you please fill in right at the end. We always do appreciate your views, your remarks, and your feedback to the various webinars that we have. And of course, as you know, that will help us enrich us for future offerings that we bring onto this platform. So just also let you know, for some that have just joined, we do have Spanish interpretation. So if you need that, please just look at the bottom of the screen and we should be able to kick that off. So thank you to everyone who has joined. My name is Sylvain Kengeja, and I'm the IFC Global Sector Lead for Health Services. But today I'm sitting here wearing a slightly different hat as EPiHC Secretariat. And it is my pleasure to welcome you all to today's discussion on earning trust and building confidence, the protection and responsible use of healthcare data, now organized by the EPiHC Secretariat. And I believe for all of us who are here, this is definitely a critical conversation as we see the world evolving. And I would say in an era where technology has literally transformed the way we deliver and access healthcare, the vast amount of data generated has become a valuable asset. In fact, the World Economic Forum, for instance, estimates that the value of healthcare data could reach as much as 300 billion annually by 2025, highlighting the economic significance of protecting and responsibly using this data. Now, our ability to collect, analyze, and utilize the data holds immense potential, of course, for improving patient outcomes and advancing medical research. However, with this potential comes a significant responsibility, and I'm sure all of you would attest to this. Now, as stewards of healthcare data, I believe we must navigate a delicate balance, right, between leveraging of that data for innovation and ensuring the uttermost privacy and security for patients. Building trust and confidence with our patients and stakeholders, from my perspective, is paramount. And this requires a few things, right? Transparency, ethical decision making, and a strong commitment to protecting sensitive information. It goes without saying. So during this discussion today, we are looking to explore the challenges and opportunities in safeguarding healthcare data while fostering trust, right? We will also discuss some practices, regulatory considerations, and emerging trends that shape our approach to data protection. And I would really encourage us to make this a conversation. Please feel free to post anything that you might have, any thoughts, comments, and questions, right in the chat. And our panelists today will be able to, you know, um, interrogate and give you a bit of more insight. So let us share insights to create an environment where I believe healthcare data is used responsibly, ethically, and securely. So again, thank you for joining us today. And to kick us off, let me introduce our distinguished panelists who will share their insights and experiences on this highly relevant and important topic in today's world. So to start with is Brad Beira. Now, Brad is a corporate advisor, 24 years of corporate governance experience, legal and enterprise risk experience. He currently works as Director of Risk and Regulatory Lead Insurance Sector at PwC. Brad comes with, since 98 has been actively involved in advising the insurance sector. He headed the international enterprise risk management practice for two multinational organizations and supported the design and distribution of enterprise-wide risk management solutions across 24 countries. So I would assume he would have been to at least one or two countries, that is one or two of countries that are represented today, in this webinar. So Brad, welcome, and really looking forward to the conversation with you today. My other panelists would be Prinesh Reddy. Now, Prinesh is a South African trained medical doctor with clinical experience in general practice, critical care, and anesthesia. His core area of focus are in digital health solution design, healthcare operations, and healthcare strategy. And he is actively involved in shaping the future of healthcare delivery through technology and a process optimization. This has led to his transition from the operating theater to healthcare technology and innovation space, with his current role as the Director of Health Consulting at PwC South Africa. And he currently leads the donor and public sector and health technology workstreams with clients across sub-Saharan Africa. Before this, he was the head of digital health product development at one of the largest private hospital groups in South Africa. So I take this opportunity again to welcome both Prinesh and Brad. So to kick us off today, Brad, I'm going to look to you quickly, and probably, do you want to probably just shape for us and give us a few thoughts on what are some of the biggest challenges in balancing data privacy with the need to use healthcare data for improving patient care? I mean, what are some of the biggest challenges that you have seen in balancing the two? And of course, what would be considered the responsible use of data, and what is not in the broader terms? Let me give that to you.
Sylvan, thank you. And thank you for the warm introduction, and welcome to everyone that's here. Those of you that are going through the chat, I'm recognizing some of the countries, and I know them, and it's been a great privilege to work in some of them. The question, Sylvan, that you've asked, and it's a beautiful question. So why don't we take like 16 or 17 hours just to answer that piece? Because it's a big landscape. And then we'll get into the really smart stuff, which Pranesh will do. But in asking what the risks are, we need to take a step backwards and say, why are we here having these conversations? And I hold up my pen. And the reason that I hold up my pen is in the very early days of my healthcare experience, which only started, I saw my first patient only in 1993. There were no such things as electronic records. You wrote things down on pen and paper. And I was very excited when I bought my first filing cabinet that had the matching boxes. And then I could color code my patient records against whether they were a male or a female, and whether they were an infant or a child. And, that was the high-tech patient record keeping in the early 90s. That's changed now. And you used to, even in the hospitals I worked in the late 90s and the early 2000s, you had record rooms and archives. And then those patients who had left after a period of time, after 6 or 7 years, you took those files and you moved them into a container somewhere else, or an offsite storage. And so business continuity meant going back into those records and finding that patient's records and bringing it back while they were still in the hospital. So that's evolved progressively into what we now take for granted are electronic health records that are sometimes a hybrid. You've got your admission records, then you've got your hospital care records, and then you've got your healthcare professionals records. And sometimes if you've got 5 professionals, they may have 5 different records. And in very sophisticated health systems, they integrate. And in unsophisticated systems, we hope that they'll share with each other. Then you have a medical funder record, which is sometimes different from your clinical record. And then you have a government record, which is sometimes different from both. So that's the world that we currently live in. And a lot of that data can now be shared at the speed of thought. So for those of you that are interested in open source books that describe this very well, there's a book called The Theory of Medical Data Donation. And it asks the question, who owns your medical data? So in order to answer that question, we've got to say what constitutes medical data. And currently, anywhere in the world that we look at this, and we'll be talking about this later on in the year in some discussions on medical data. But your medical data is any identifiable health data and personal data of any living person. So that can include your name, your social security or identity number, your telephone number, your IP address, your state of residence. It will also include any biometric data. So I call you fancy, if you've got a smartwatch that speaks to your smart device, the data that's captured is also personal health data. Any journey that you have, any health experience that you've had, any medicine that you've taken, any destination that you go to for any sort of healthcare, all falls into that. So then the question is, who owns and controls that data at what point in time? And we've seen that that's changed. So in answer to your question, what are the risks of data, of a healthcare data breach? You've got to start by saying any data that relates to you as a person and other people in a community is healthcare data. And Pranesh, before I go too much further down this, I'm going to handshake with you so that you can develop that a little bit further.
Thanks, Brad. And once again, thanks, Sylvan, for the introduction. Also really nice to see some familiar names in the participant list as well. So I think really bringing it down to a practical aspect, in terms of what does it mean for organizations and people on the ground. This balance is really critical because on one hand, it centers around this need to ensure that there's at an individual patient level some sense of autonomy, justice, and non-maleficence in the way in which the patient is treated. And on the other hand, as Sylvan's mentioned, we see that there's a massive amount of power and value in the data that can be harnessed at a population health level. And within it, there's this ability for beneficence or the duty of doing good. So really balancing the importance of privacy at an individual patient level with the utility of healthcare data on a more broader or population kind of level is really critical in considering this. And when we're looking at potentially this balance and what the challenges are and really finding out where a good middle ground is, there's a couple of elements that we've seen are really key in it. And we're going to unpack a couple of these, as we go along today's discussion, as well as in what we do in the workshops later in the year. And the first one around this is informed consent and patients' rights. And we'll discuss this probably in a bit more detail later. The second one is also algorithmic bias and what we're seeing around algorithms and what's being developed within health technology specifically. Data silos and regulation also perform or create quite a challenge in ensuring that this balance exists. And then on the other hand, we're seeing issues around cybersecurity and the threat that really is quite pertinent and relevant in our world at the moment. The ability to retrieve data and have that data secured story is also critically important. And the challenge in balancing, are we really favoring the individuals and patient level sort of protection and security higher than population level needs is another factor to consider. And then really our advancements in technology and cybersecurity are potentially going to help us ensure that this balance is far more equitable in the future. And really to, Sylvan, to close up on this, the challenges really underscore the importance of a real comprehensive multidisciplinary team when it comes to healthcare data management, right? Clinicians can't do this on their own. CIOs and information technology teams can't do it on their own. Really, it requires close collaboration in what's brought to life within these organizations.
Yeah. Absolutely, and thanks both Brad and Pranesh here. So in my opening remarks, one of the stats that I quoted was the fact that I think the World Economic Forum estimates that the value of healthcare data could go as high as 300 billion over the next couple of years, and probably it's already past that, right? Who knows? But the question I have for you, maybe coming back to this, is what would you consider responsible use of data, and what is not responsible use of data, right? So in broad terms, when you think of it, and Pranesh, you having been an operator, what would you think is considered responsible use? And Brad, as you think of it from a risk perspective, how probably would you position this in broader terms? What you'd consider to be responsible use and what would not be responsible use?
Thanks,
Very
Sylvan. And I
fair
think,
question. Pranesh, would you like to start?
yes, Brad. I think the first kind of things that we need to consider here really for us is, how do we, from a practical aspect, ensure patient privacy is maintained? How do we maintain trust in the healthcare systems in which patients are accessing, and their providers and applications? At the same time, ensuring that there's ethical and legal use of sensitive medical information. And then within that, as we said, the balance of leveraging data to improve patient outcomes, whilst safeguarding patient confidentiality and autonomy. So when we're looking at this, using data responsibly, I think some of the key considerations and principles that come to mind are, firstly, data de-identification becomes critical, right? Especially when we're doing population level outcome type data, ensuring that, within whatever the guidelines are relevant from a geographic and regulatory perspective are put in place, the de-identification of data is a critical part of this, and ensuring that those safeguards are in place so that, no identity leaks happen is really critical. What's very closely linked to that is data control. And this is really to ensure that unauthorized access of identified data is occurring. Limitations and control of use and access to systems is also probably another big one, and this really needs to be overlooked, and that's where collaboration between providers and the people involved from a system perspective become really important. And then maybe last two before I hand over to Brad, that for me are really important, is transparency with patients and stakeholders across this chain become really important. We have to acknowledge that patients are really a critical part of their journey, right? I think that is starting to become a core part of patient-centered healthcare and how that's delivered in time as it's going on. Really before it was practitioner focused and really quite paternalistic in the way healthcare was delivered, but the involvement of the patient in their journey and acknowledging that they have knowledge and responsibility within this journey is quite critical. And then the last thing is really oversight and governance. Without that, the process around managing responsible data is difficult to do. Brad, to hand over to you.
Thanks, Pranesh. So to the question, there was a comment once that said data is the new oil, because the more data you have, the more you can modify your advertising, your marketing, your orientation, your services towards a population or a group that you want to do. So when I wrote on this in 2018, what was very interesting is health data is used in a tremendous amount of ways. It's used to predict travel. It's used to predict human movement and migration. It's used to predict and is a predictor of weather and socioeconomic consequences. It's used to predict political uncertainty. It's used to predict vulnerability. It's used to predict consumer confidence, which then gives you a sense that anything that we can do where we've got data around an individual, we can extrapolate into how that can be made into making more money. And whilst Pranesh spoke about the importance of altruism and being beneficent and non-maleficent in medical ethics. In other words, let's be nice to each other and let's do things for a good cause. We live in a commercial world where opportunity drives conduct in many ways. And because opportunity drives conduct, and we regard any patient as a vulnerable person, which means any person in any state of health that's outside of their optimized health is potentially vulnerable. We go back and we've set control of how the use and protection of personal data in healthcare must be. So to age that, I was saying, I know how old I was when Google was started in 1998. But the Health Insurance Portability and Accountability Act, which was the first statement around data privacy in healthcare, dates back to 1996. So if we start thinking as early as 1996, there were very clear rules in place for the protection of healthcare related data. If we step forward and we go back to, and we go forward then to in South Africa specifically, 2013 was the beginning of the Protection of Personal Information Act, which came in 2021. But the GDPR, which was revised from 94, was revised to 2018 around the identification of what we regard as special and protected data. So Sylvan, then in the specific answer to your question, you need meaningful consent. And meaningful consent says, we're going to collect this data about you to be used by these people in this way for this purpose, after which time it will either be stored and processed in this way or destroyed in that way. And that's that consent journey that Pranesh was talking about earlier. So increasingly, as we start to collect more granular data, we're obligated to give the person that we're getting it from a very clear indication of what we're going to do with it, why we're collecting it. And the reason for that is because companies would collect data for one thing, and many of you will have experienced telemarketers where you're about to go to sleep. If you're like me, 7:30 at night, I'm asleep. 3:30 in the morning, I'm awake. But I say to the telemarketer, well, why don't I call you when I wake up? But that use of data for the purpose other than what it was intended became a big issue. And so that includes then how we collect data on genetic data. And when we start looking at genetic data and we start looking at clinical trials data and consumption data, that has an imperative in terms of the Fundamental Declarations of Human Rights from 1948. Why am I telling you the story? Is because there's always been, well, not always, but in our recent 60 years, the awareness of the protection of data, but also the opportunities to exploit that data. The reason that I say that is when you give your data to another entity to use that data, your data is your data until it's combined with everyone else's data. Then it belongs to the entity that's combined it. So there's a very clear line that you need to bear in mind between your data and then everyone else whose data is aggregated for the purpose of epidemiology or the purpose of public health screening or the purpose of the prediction of a pandemic. So not all data there is created equally. Sylvan, does that answer the question?
Well, I think that's really great, Brad and Pranesh, and I think I like the analogy you gave about data being the new oil in the 21st century, right? And I think it's Peter Sodergaard, I think, who takes it further and he then says, and analytics is almost like the combustion engine, right? So you need the data is the oil, but you need to analyze it and to create that combustion engine. So I think that's a really great analogy, and I do like that. Now I want to switch gears a little bit, right? Because one of the things that there's a journal on medical internet research which has found that 81% of healthcare organizations in the last 2 years have experienced at least one data breach, right? Almost 81%. Now it could be insurance companies, it could be hospitals or whatever it is, but they say at least around about 81% based on the pool of research study they did experience at least one data breach. Now, my question comes back to you, and Brad, I'm going to look to you, then look back to Pranesh here. What would you consider to be some of the best practices, right, for protecting healthcare data from breaches and unauthorized access? Because I think we do see this quite rampant in a lot of emerging markets, right? There are breaches, there's unauthorized access. And of course, I'll probably also want to get a sense from a regulatory perspective. How do you think organizations can ensure compliance with data protection regulation? You just spoke about South Africa that has launched the POPI and all this. Now, how can organizations also ensure that they have the right levels of mechanisms internally to protect, data from a regulatory perspective. But I just wanted to understand, how do we protect data from breaches and unauthorized access? Then, of course, from a regulatory perspective, how can organizations think of dealing with this?
Fair comment. And I'm going to give you a couple of layers to this, and then Pranesh will be very specific, because the difference between Pranesh and me is I like to talk at 42,000 foot looking down on the world, and he likes to navigate the actual road that we're going to be traveling on. I start with three things. Sometimes the breach is to test to see if we can break through somebody else's system. And so you've got unethical hackers who do that to try and see if they can get through. How do we manage that? We get and hire ethical hackers whose job it is to test the cybersecurity that we've got on multiple different levels, and we'll come to that later. So not all breaches are the same. Some breaches are with the purpose of disrupting the organization or the group of organizations. Some are to demonstrate that there are vulnerabilities then that are used by unscrupulous vendors to drive data protection technologies. So the interesting thing of the majority of companies that have had breaches, the consequence of those breaches have often been very low in terms of patient exposure. But the cost of the company investing in data breach protection has been very high. So I'm going to draw your reference at this point to an article that was published by the Texas Law Review called Risk and Anxiety. It's the theory of risk and harm. And really what it says is there is only claim against your data being exposed if you experience a tangible harm. So a lot of the data that's stolen isn't stolen with the purpose of an individual being exposed or extorted or identity theft or the theft of their money. But there's the potential that it may happen in the future. And I'll give you an example of where those risks sit. So that's something to bear in mind when we talk about data breach. What data was stolen and what quality of data was stolen and what might it be used for? So in preparation in your organization or whether it's your private practice or whether it's your hospital or whether it's your health system, you need to start thinking who might want this data and why. So stealing the data for commercial on-sell is one example. And that's gone through from genetic databases to biobanks to children's hospitals to hospitals that specialize in a particular kind of disease management. Then you've got the data breach that's designed to disrupt your organization, a ransomware that says, if you don't pay us a ransom, you won't be able to access these files. Those are quite uncommon in healthcare because the criminal consequence of shutting down persons' availability to care that leads to their death means that those hackers have the potential of being criminally charged for the death of that individual. So you very rarely see a ransomware lockout, but they do happen from time to time, specifically with more advanced technologies. So those are the common themes that you need to be aware of with breaches. The third piece of the breach that you need to be aware of is whether that breach has direct or indirect impact on the continuity of care. So as we move increasingly into electronic records and electronic prescription, one of the big things that we see is there's a vulnerability to e-scripting. Why? Because now I can have access to my favorite medicine without going to the doctor's office and stealing the script pad, or without going into the pharmacy and breaking in and stealing the medicines in packets. I can digitally recreate those scripts, and I can then use that as my what they call pill slinging. I can sell my medicines using the technology that I've used to break into the system. So the first thing that one would want to do is understand, why is one vulnerable to a breach? Where is one vulnerable to a breach? And what would a breach do to the ongoing continuity of care that one gives? Pranesh?
Thanks, Brad. And I think I want to take us back, down to ground level and facility level. And I think one of the things that's really critical about healthcare, and maybe contrasting it with other industries, is that for the future, healthcare is always going to be human-led and technology-enabled, right? I think what we cannot forget is that there's a human element in everything that remains. So technology will progress, and there will be massive leaps in the delivery of technology-enabled healthcare, but people will still be at the center of what we do. And I think I really want us to keep in mind that healthcare staff and staff working within organizations probably still remain one of the largest threats to actually security and health data breaches across, across healthcare specifically. And how do we start looking at this and approaching it? Regular training and awareness obviously are critical, but something that I think is really important is that we need to start sort of embedding this within the healthcare education curriculum. We're seeing that healthcare practitioners across all levels are increasingly becoming involved with technology within their educational programs. Similarly, the approach and protection of data and handling of data within the curriculum needs to occur. And within this, it's about educating and equipping healthcare workers and staff within healthcare organizations to understand principles of data protection from a practical perspective. In addition to that, how do you operationalize data protection within a facility or organization within your work? Understanding healthcare information systems and potential risks within that, it's really critical. Teaching healthcare workers to balance this need for health and personal data protection with doing good for patients and potentially a larger population at whole. And really, education and empowerment within this becomes critical. So all the elements that Brad mentioned are key, and from a structural and architectural perspective, very important. But I want us to always remember that there's a human element to this that we cannot forget. And bringing people along, especially people that are working within healthcare, along this technology journey, and enabling them to be a part of healthcare data safety is really important.
Yeah. Thank you so much. And to our participants today, again, if you just joined us or you joined us a little later on, please do feel free to keep putting your comments in the chat. We are seeing them, and we are going to attend to some of them, and hopefully some of them can be attended to as we have continued this conversation. And for those that are joining us from or prefer Spanish as a language, please know that we do have that available through our interpretation tab, so you can just go there and have access to it. So look, I want to get back to our conversation again, Brad and Pranesh, and I think you have touched right on what are some of the practices that you have seen or protecting data from breaches and so forth. But there's a survey at some point that was done by Deloitte, which found that it was a consumer survey, particularly in health, and they said almost about 73% of the health consumers who were part of that survey were willing to share their personal healthcare data for research purposes, but only if privacy is protected and they have control over how it is used. So now building trust becomes a paramount issue here, right? Now, I wanted to get a sense from you, and I'll probably start with you, Pranesh. What are some of the strategies that we could implement at facility level to build and maintain patient trust when using their data? You could probably relate this, say, in emergency situations. How do you handle patient consent and data, particularly say in emergency situations? But just generally, broadly, what are some of those strategies that you can implement to build and maintain patient trust when using healthcare data?
Thanks, Sylvan. And I think the cornerstone, trust is really the cornerstone upon which that interaction between the patient and the practitioner, or on a larger scale, the patient and the facility, or healthcare organization looking after them is built. And as healthcare organizations and practitioners as well start to rely on digital platforms, technology, and artificial intelligence, which is kind of the buzzword and hot topic at the moment. Maintaining and establishing trust between the parties involved is really critical. I think to kind of call on the three big ones that we believe are really important here. The first one is really enhancing effective communication, right? Transparency and expectation management and communicating effectively between these parties is really important. It's something we take for granted, but being able to effectively communicate certain aspects of care that maybe are not, directly linked to clinical care are important, right? And part of this is looking at data and consent within that, and really that involves the patient, not only understanding their condition, treatment plan, and any necessary lifestyle changes that might be part of their clinical plan, but also how do you communicate, what's happening with their medical data within the facility and within their ecosystem. Secondly, I think, having a personalized patient-centered element to it is really critical, right? We really need to make sure that patients on an individual level understand, how it impacts them, as Brad has mentioned, and what that means for, for their care journey, and how their data is going to be handled over their lifetime. And then maybe the third big element that I see through this is patient education, right? Once we're making sure that care is technologically involved and involves things like artificial intelligence and machine learning, it's really keeping patients abreast of what could potentially, happen within their world from a technology perspective, and making sure that they're owning and being responsible for their own health data within that. And then maybe to touch on this element of consent. And I think the emergency situation brings up an interesting one, and the sort of principles that I think we need to use to consider this and respond to it are that, in the emergency situation particularly, delivering care still becomes of paramount importance, right? I think you need to have the right systems and structures in place, that the data elements of consent and communication are incorporated into whatever is done. But at the end of the day, the patient outcome in clinical care is really critical within that. And we know that this will differ, based on region and geography, perhaps. But some of the really important things to remember is that implied consent in emergency settings, stands, and the data element needs to be incorporated within that. And I'm sure Brad will talk in more detail about the legal and ethical aspects of this. But on top of implied consent, really documentation is critical. And I think that's something that we were taught, as practitioners, and we'll drive that home within the clinical aspect of it. Documenting what you did and what has happened during the journey, particularly in emergency situations, becomes really important, because that becomes your kind of letter of the law when you go back to it. And really, probably the last element of this is making sure that processes exist, right? And educating healthcare practitioners about this process. What you don't want is that in an emergency situation, you want people for the first time to be figuring out, how do we do consent, particularly within the world of an EHR and health technology. So training and educating healthcare practitioners, as I mentioned, is critical to this, and ensuring that they're trained and geared up to deal with this across all settings, whether that's outpatient or ambulatory care or emergency settings. Brad?
Yeah, thanks, Pranesh. I have a 3-word answer, and then I'll build it out. And it also answers a question that was asked earlier: who's responsible to validate the data? And so my answer is trust, but verify. And what do I mean by trust but verify? One of the biggest challenges we have once we've got data is access to that data. So many of you may have a home. I'm assuming that if you do, you lock the home when you leave and you unlock it when you come back. If you have a car, you lock the car when you leave the car and you unlock it when you come back. And if you have a mobile device, I'm assuming it's at the very least got a password on it. And at best, if you're very mature about it, you've got a password and some kind of biometric as well. In other words, a 2-factor authentication. So what you should be doing on an ongoing basis is trusting that people will behave, but making sure that you verify that. So this comes back to a rule of law that goes back to 1703. So it's a fairly recent law, and it says, what would the reasonable person do? So as you go through the protection of data and consider what you need to do, and you take the trust but verify comment into account, what would the reasonable person with the same or similar education and experience do in a same or similar circumstance to protect their data? And that would be the basis for how you would apply your data protection journey. Would you let anyone walk in to your house at any day, or would you restrict access to certain times when you're there? Would you allow anyone access to your bank account, or would you want there to be a verification if somebody tried to spend your money? And you treat the data the same way. So the first thing is the access to the data on a trust but verify basis. Does that make sense?
Absolutely. Absolutely. And I like that. Yeah, go ahead.
The second thing, and you'll notice I'm referring you to various books and articles because nothing helps but going and reading stuff yourself. There's a general surgeon who many of you may have met or read or know, Atul Gawande. And Atul Gawande was asked to look at why we have certain clinical outcomes that are less optimized in certain areas than others. And he found when looking at the construction industry and the aviation industry that we often leave something out. And so he suggested if we want to be the most efficient at what we do, write a checklist. And the book that I'm referring to is called Checklist Manifesto. And if you were to write a checklist about what you needed to ensure data protection from a behavioral point of view from your patient, because often the patient opens the door to a data breach. Because the patient's device is stolen and there's a login to your facility. I got called once. It was the scariest thing in my early medico-legal days. I get a call and they say, "Are you Dr. Byra?" I say, "Yes." He says, "I'm Detective so-and-so from the police station." They almost needed AED paddles to resuscitate me. I got such a fright. But I said, "Well, why are you calling me?" They said, "Well, we've got a phone, a mobile device, and yours was the last number called. So we're calling you because when we went through this device, we saw a whole lot of patient files on it."
Wow.
Okay. Now we live in a world where if you're using electronic records, they're often on your mobile device or on your tablet or on your laptop. Some of you will be old enough to remember when we had analog dial-up off our desktop. Remember when you had a freestanding tower and that you'd push the button and that piece would come out, which was your coffee cup holder. And if it wasn't, it was your floppy drive. So nowadays, and that was very central. To steal that was hard work, but to steal a mobile device, like my device that you can't see because my screen won't allow you, to steal the device with everything that's on it, with all the interconnectedness, is very easy. So you need to be able to map out the process of how might anyone get access to your stored data, whether it's on the cloud or whether it's on a domestic server or whether it's on your local device. Mapping that out allows you to then have a checklist to say, when I log in, did I have one-factor authentication or two? When did I change my password? Is it a strong password or is it a lousy password? What does that password give me access to? And what are my delegations of authority? How far can I get into all of the data? And how limited I am against what my rights to user access are. If you do that and you create the checklist for yourself, and anyone accessing the data from any point always follows the checklist, you are minimizing the risk of leaving out a step and making yourself vulnerable. Now, everyone's data environment will be different, but there are certain consistencies. And so one of those consistencies, and you heard me say it earlier, I'm going to handshake with Pranesh to change when each of us speaks. Now, in a healthcare data environment, your devices, your smart devices, your patient monitoring tools, your insulin device, your heart device, your SpO2 device will handshake with your electronic record. And your electronic record will handshake with your hospital information system, which may handshake with a third-party payer, or with your pharmacy system, which may handshake with your laboratory system, which may handshake with your central system. Each of those handshakes uses something called FHIR, Fast Healthcare Interoperable Resources. Aware as you create this checklist that the technology smart people that you engage with create data protection access at each of those points where a handshake or an API happens. Pranesh, do you want to build on that? Is there anything else that I've left out?
No, Brad, I mean, I think that's all relevant and valid points. And Sylvan, bringing it back down to, that ground level and practicality of it. I think really, once organizations and and maybe smaller practices and clinical delivery centers have those architectures and principles set up. I think transparency and communication are still key, right? It's really, making sure that patients are informed about their data, how it'll be used, so they can make informed decisions. And during a consent process, it mustn't just be hidden on a consent form somewhere, right? It must be visible, easy to understand, and front of mind as well. This idea of empowerment of patients through knowledge is really key. I think having that transparency and being upfront about it is really a critical way of delivering trust and building that trust between the patients and organizations in this case. And then I think secondly, within trust comes accountability, right? So what is the organization responsible for? What is the patient responsible for? And I think what that really helps is it helps us to proactively mitigate fear within this ecosystem. I think there's a lot of fear and anxiety at the moment, as Brad has mentioned, around the data and the power of it and its value. But outlining clearly what the organization's roles are and how the data is going to be used and stored, keeping things in mind that it's practical and isn't a flood of information for patients, but it's giving them enough so that they know who's accessing the data, why they're accessing it, and proactively dealing with that upfront really means that people are less likely to worry. So that transparency and accountability, I think, is a key part of building trust.
Yeah. No, thank you so much. I before I move on to my last few points that I want you to bring through, and I think you've already touched on some of that, I want to probably open up a little bit to questions, right, from some of the colleagues that are joining us from all over the world. Probably I'll take about 2-3 questions from the floor. If anyone, probably you have a question, just quickly raise your hand, and hopefully we can probably see if you can chime in and throw in your question in as well, right? So we'll be happy to do that. We've got a few that have come through, I think through the chat, and there's one in particular that we'll probably attend to that probably relates to AI and so forth. And I think the question is, who is responsible to validate all the data? And I think sort of Dr. Brad, you kind of like touched on that a little bit earlier, but we'll come on to that probably as we go right to the end. So if you have got a question on the floor, please do feel free to raise your hands as we probably see who is coming on board. I want to look back again to you, Pranesh, and probably look at it from an ethical perspective, right? So what would you consider to be some of the ethical dilemmas that healthcare organizations encounter, when using data, right? I know you've touched on some of these, but do you just want to high level just summarize on what you consider to be some of the key ethical dilemmas that you have come across or that you see as a practitioner, I would say?
Great, Sylvan. And I think that just to highlight, as we enter this era of digital transformation, which I think in healthcare is really just we're just at the start now, right? I think this is going to become even more pertinent and front of mind as digital transformation really speeds up within our industry. I think it's been said that healthcare has probably lagged behind other industries over time, and these concepts and discussions around the ethical considerations are only going to escalate as we speed up and increase the rate of digital transformation within the industry. And a big part of this is that we're seeing organizations learning how to leverage data to improve patient outcomes as well as operational efficiency in a lot of areas. And this data-driven approach is probably the root of where the ethical dilemmas start. I think the first one is something that we've spoken about a few times, and it's really probably the most important one, is the privacy and consent aspect. The collection of data from the start really has concerns about privacy and consent. We're starting to see that patients believe that data is collected without their explicit knowledge or consent, and this is leading to these potential violations of privacy. And really, healthcare organizations need to ensure that the consent process and that informed consent process is done through transparency and accountability, right? And having transparency around how patient data is going to be used is a critical part in navigating this ethical
journey.
quandary.
Yeah. I see Yana has thrown a question in the end, and I think, and Brad, I'll look to you on this. What would be some of the key risks that you could say for organizations that on the high digital maturity curve versus those around the low digital maturity curve? What are some of the key risks and considerations that you think both organizations in those states would need to make in respect of the conversation today?
Okay, I think that's a great question, and it opens up self-assessment of maturity as well. But let's define a low digital maturity as a significant amount of the organization's transaction, whether it's admissions, ward records, prescriptions dispensing, coding, billing, recoveries of monies, all being done using pen and paper or manual technologies, or the majority of that. So the more manual the systems, the lower the digital maturity. What are the risks? There's a risk of data loss. There's a risk that if you have a flood or a fire and your record room burns down, you lose all your records. Whereas if you're a very high data mature environment, we used to have these things called disaster recovery sites, where if things fell down, you know, if you couldn't operate, you would go to another site to operate. Now we have the cloud. So one of the benefits in a high digitally mature environment is the preservation of records is so much stronger than it used to be. Equally, the integration of the continuum of care. So let's say I'm the patient, and so you and Pranesh and two others are clinicians. In a highly digitized environment, the likelihood of ongoing high-level care is significantly higher. Whereas if I'm in a low environment, the need for people to be there with their physical records, with their questionable legibility, comes in. You know, we often joke and say, how did I get into medical school? I hand wrote my my application, and anyone whose application they could read, they threw away, because clinicians are notoriously bad at writing, or they choose to be bad at writing because they're largely illegible. I often review clinical files and I don't know what the note says, because I can't read the writing. It looks like a spider's fallen into ink and had a seizure. So the low groups, the low maturity groups, have a higher risk of losing that data irretrievably. But they also have a poorer continuation of care and a lower access to environments where, you know, on a telehealth point of view, where you don't have access to care in peri-urban or rural areas. If you've got a highly digitized environment, your ability to provide access to care in peri-urban or rural patients significantly increases. The ability to manage those records significantly increases, and the ability to save that increases. The risk is, if you're a highly digitized environment and your system goes down for hacking or for power or for corruption, you lose the ability to provide care. So those are the two tensions. I must be honest. Sometimes, and most often in hospitals I've seen, or health systems, there's a balance. And I want to give an example of immunizations in Afghanistan very briefly, and then I want to answer one or two more questions. In Afghanistan, the way that they wanted to manage the vaccination journey, they didn't have electronic records. So what they did is they gave the child a string bracelet with one bead. And that bead, if you had your first inoculation, was the red bead. Regardless of where you went for the second inoculation in 3 months' time, if you had a red bead, the next bead you got was the green bead. And the bead after that was the yellow bead. And that was their way of doing a transferable record for vaccination and immunization. So sometimes low tech works. So that's my answer to the question in terms of...
No, thanks. I have a couple of more questions for you, Brad and Pranesh. So, Brad, I mean, you of course are very strong from a legal perspective. I mean, Marilyn Keegan here is asking, right? Can patients sue for breach of private data? And thanks, Yana, by the way, and thanks, Marilyn, for that question. Go ahead.
Yeah, it's a great question, and it goes back to the article that I shared with the group, the one on risk and anxiety. You can't sue for fear of loss of your data. You can only take an action if you can demonstrate that the breach of that data has created harm for you, financial harm, employment harm, or social harm that's demonstrable. Because the court says, show us the damage as a consequence of the breach. So what happens, and just on that note, when there's a lawsuit against a clinician or a hospital, almost all of that is around delay in care, failure in care, clinical outcomes that are undesirable, complications. Patients almost never sue for informed consent or failure of consent unless it's related to an outcome that was adverse. So in South Africa now, this year is 100 years since the first lawsuit on a failure of consent leading to an adverse outcome.
Wow.
So they can sue. It's very hard to demonstrate what you would sue for in the event that there's a data breach, unless you can demonstrate that there was what we call a pecuniary loss, a loss to your livelihood.
And maybe there's another one right there as well, probably along the same lines, and probably Prinesh as well, feel free to jump in, right? And thanks, Albino, for this one. And I mean, the question is with regards to insurers, for instance, right? How safe is the transfer of medical records, and is it ethical for insurers to go through all medical records, for their clients or for their patients?
Thanks, Albino, for the question. And Sylvan, I think this ties in nicely to what Jan had asked around, organizations with high digital maturity or ecosystems with high digital maturity. What we're seeing, and it's happening in South Africa in the moment in the private sector predominantly, but there's the establishment of what we've called this HIE, or Health Information Exchange, right? And to Albino, to your point, it's not just insurers that are involved with this, right? It's insurance data, it's provider data, it's probably pharmacy data at some, in some aspect as well. So it's really a consolidated view of a patient record that's within this. And I think, some of the principles being used locally in South Africa within the setup of this is that has to be de-identified, right? I think the setup and the establishment of this, particularly at a population level, has to be that it's taken with a view of de-identification. Obviously there's obvious risks here in terms of we then end up having, quite a substantial record for an individual sitting in a single place. And this within ecosystems of high digital maturity pose quite a significant risk. So those guardrails and structures and governance around how the data within an HIE and sort of data lakes at population level are managed becomes really critical. And I think probably the de-identified structured approach of that data becomes quite important.
Yeah.
Brad,
yeah.
I don't know if there's anything else you want to add about that, but definitely as we're seeing digital maturity within countries and ecosystems accelerate, this becomes a key one. Particularly the sort of susceptibility with cloud technology and probably an HIE alongside manual, outdated legacy technology also poses additional risk. But this pool data really is a challenge.
Yeah.
Can I build on that, and then Sylvan, with your permission, also answer Jana's question?
Sure, please.
There is a second piece, Albino, to the question that you raised. Is it ethical for insurers to go through all medical records? One of the things that one should remember is that ignorance is no defense in the law. And so when you engage in healthcare and you enroll into a hospital or into a healthcare system, there are terms and conditions. The small print applies. And often and it doesn't matter if it's the public system or the private system, there are still rules of engagement. And certainly with private funders, and sometimes with private insurers, but also with state and national insurers, their terms of use contract says that your data will be used as needed or as appropriate, both for your own health and for the betterment of public surveillance. So if you've got a private insurer and you've given them permission in your policy or in your contract to go through your medical records, then they're perfectly empowered to do so. That's part A. The part B is when we use a national health insurance, public health, we're doing it under the rights as a citizen, but also the obligations of the government to provide us a safe environment to live in. And sometimes that means the epidemiological surveillance of what we would call notifiable diseases. Tuberculosis would be an example of a communicable disease. A non-communicable disease prevalence that would be important could be diabetes or a particular gene-mediated breast cancer. So sometimes the data is used, and where a risk is not only in the disruption in the continuity of care or in the continuity of service. It may also create a potential prejudice for a subgroup or a subpopulation if that health data is used in a manner that prejudices them or limits their rights to freedom, to access, to employment, to residence, to migration, and to movement. So there are layers of involvement depending on where the breach happened. If it's at a local hospital or in a local health district, the risks of continuity of care are the most significant. If those breaches happen at a public health level, the risk changes into potentially a public safety risk.
So I mean, and thanks to you both, Prinesh and Brad, for bringing those key aspects to light. Now, I mean, we of course are running out of time, and in a minute we have to be rounding off. So I wanted to kind of look at it from a global perspective, especially in the work of all these emerging technologies, right? So if you think of it from the context of AI and machine learning, I mean, how do you view, how these emerging technologies are impacting the use and the protecting of healthcare data, right? So we've got Chat GPT and all other, similar like AI generating programs that even in some cases are even being used in health. From your perspective, how do you think these new emerging technologies will impact the use and the protection of healthcare data? And to date, what has been your experience with some of these as well? Go ahead.
Pranesh, do you want to start or should I?
Sure, I'll give it a stab, Brad. And I think the key element specifically to highlight within our geographical setting within Africa is that, by 2030, it said that there'll be 6 million healthcare workers short within the continent, right, across doctors and nurses. We're not going to bridge that gap through training over the next sort of 6 years or so, right? We're going to have to leverage technology, and particularly AI and machine learning is the type of technology that's going to help us close that resource gap and improve access to care, quality of care, access to specialized services, and reduce waiting times within our world. So, really, this is going to become forefront of what we're doing. And probably one of the biggest challenges that we can see going forward is that whilst technology is very accelerated and happening at a really rapid rate, particularly in our settings, does regulation keep up, right? So we're having this kind of disconnect between the barriers being pushed within care delivery and actually what's happening within the world. But how is the regulation and the governance from a policy perspective able to keep up? And really, there's a risk that it falls behind at the moment, right? That regulators, are behind the technologies that they're trying to govern. And I think particularly in our setting, this is a big risk. I think other big components that AI starts to and machine learning start to bring to fore is the ethical considerations around responsible use of AI and the type of population sample to come up with models. I think that becomes really critical and is a hot topic for discussion at the moment. And then the standard sort of health technology risks that come with it are also magnified within the world of artificial intelligence as it becomes more widely adopted and used. So data access and control are still considerations that can't be forgotten. The risk of privacy breaches become important and must be maintained, and de-identified anonymized patient data also within AI is really critical. And maybe the last one is just the efficiency and productivity element of it. So we've really seen that artificial intelligence can lead to better care and outcomes, but also, how does it really improve the day-to-day activities of healthcare practitioners as well? So, I think some of these considerations are going to be becoming important. And as, in a nutshell, as AI becomes more widely adopted and its benefit and use, particularly in low middle income countries, is quite clear. The need for regulation and governance, to ensure that it's adopted in a safe and ethical and responsible way becomes critical.
Agree. And so Sylvan, you asked the question, how's technology changing healthcare?
Mm.
When I was kind of getting into the rhythm of my practice, we had this desk reference called a Merck manual. And the Merck manual that I had from 1999 was about as thick as my fist. And if I wanted to know symptoms, I would thumb it through and I would find the symptoms. I also had the Merck manual from 1899 that was this thick.
Wow.
And then I had a similar book this size, which was called the MIMS manual, which was the pharmacology manual with a list of all of the medicines. Nowadays, I have a scheme, an app on my phone that gives me diagnosis, most appropriate meds, dosage of meds, contraindications, and alerts. So technology has fundamentally improved our access to good decision making. It's also sped up access to care, which is great, which is really what we're aiming for in any health system. What it also does is it creates the vulnerabilities of not doing good, thorough examinations because you can't see or hear the other person. It opens up some of the risks because I always say the best way to understand where risk sits is put money on a table and leave the room. Because there's somebody in the room who's going to take that money, even if it's not theirs. There's somebody in the room who's going to behave in a manner that's less ethically good than everyone else. So one of the biggest challenges we have in evolving healthcare is the ethical use of access to data and the ethical use of data. And that needs to be taught. And it needs to be taught not once. It's kind of like hand washing and an infection control protocol. You've got a CSSD in the hospital. You've got a patient safety and hygiene person. And they go through and they teach people on a daily and weekly basis, and they swab everything, and they show there's a MERS growth here, and there's a bacterial colonization there. And it's the same thing in managing data risk. Education is not come into the room for 20 minutes, have one lecture, and you're done. It's an ongoing awareness campaign. It's an ongoing ethics campaign. It's an ongoing knowledge campaign to ensure that it is your job every day and every day.
Wow. Well, thank you, both, Brad and Pranesh. And in a minute, I'm probably going to be asking you just to make a few closing remarks. And one of the things I'll probably want to hear from you, as we round off is, what does the future of healthcare data protection look like to you? And how would you think organizations need to stay ahead of the pack? As we see all these new technologies coming, how does the future look like to you? I mean, any crazy ideas you have come across? And of course, how can the various organizations represented here, how do you think they can stay ahead of the pack of this potential challenge? Maybe I'll start with you, Pranesh.
Thanks, Sylvan. I think, again, the way forward really is going to be about a balance, right? It's about, having the balance between how do you leverage technology to improve care outcomes and improve patient mortality and morbidity, right? While at the same time ensuring that you've mitigated any threats and data privacy issues that this new technology, brings to the fore. I think it's about staying informed, proactive, and really this will help healthcare organizations navigate this landscape effectively and responsibly. And I think a big part of this is community, right? You're not going to be able to know and understand every element of this as it evolves by yourselves, right? And I think being able to lean on experts and collaborate within a world similar to what EPiC offers is really key. To be able to leverage off lessons learned in other geographies and similar geographies is really important. So as this world evolves, I think it's key to embrace technology and make sure it helps you to improve patient outcomes, but at the same time prioritize data privacy and security. Be proactive about addressing any emerging threats that occur within your ecosystems. And then the last thing that I mentioned, and I mentioned it, in what I said previously, the regulatory component is key. So figure out your role within the regulatory environment and how you can drive regulation to keep up with the speed of innovation. Because if there's a gap and a dissonance between that, it opens up the broader ecosystem to risks. So I'm excited by what the future holds. I definitely think, specifically within our context in South Africa and Africa, looking forward to seeing how it helps us broaden access and quality of care as well.
But Prinesh, to you, before you go, you are a practitioner, right? You have walked the hospital corridors, you've been in theaters, in and out. Well, what does this mean to me, right? As a nurse, as a hospital owner, as a practitioner, what does this all mean to me? And what do you think I should be thinking of, or at least the key takeaways for me from this conversation today? Just to break down as you think of it high level, to a person who is in the hospital day by day.
No, definitely, Sylvan. I think the first part of this is to understand that this is part of your world, right? I think, making sure that from an empowerment and education perspective at a facility level, that your staff are empowered, and at an individual level as well, having some form of knowledge and understanding of how it touches you specifically on a day-to-day basis becomes important. I think, learning to include your patients and consumers essentially in this discussion around data, particularly within a healthcare setting, becomes important. Don't be afraid of having those conversations, even though it might be new and evolving. And then I think, going forward for healthcare systems and healthcare organizations of the future is, I can't emphasize this more, but it needs to be part of our learning, from a curriculum perspective. If people are learning about these technologies, as Brad has mentioned, and it's a part of daily life, the ethical considerations and the practice considerations of it also must become important. So let's embrace it, but make sure we understand the limitations and the importance of enabling it to be rolled out and innovation to occur in a safe and ethical manner as well.
No, that's really great. So Brad, where is the future going? And in your mind, how do you see the future of healthcare data protection, particularly for organizations and even regulators who might be on the line today?
Sylvan, I always wanted to be the regulator. It was like my dream job. And so now I sit on the risk and regulatory side. I'm the happiest guy in the whole world. People say to me, why do I work? I said, because it's like my hobby. It's the best thing.
Yeah.
Because different people are good at different things. Okay. I loved practice, but I'm not in practice because I'm better at this than I was in practice. And the reason that I say that is if you had somebody working in your home as an electrician, would you want them to do your abdominal surgery? Your answer is maybe, but probably not. And so it's the same thing when we start talking about data. You need to invest in people whose expertise is data, whose expertise is cyber, whose expertise is end-to-end technology. This is not, oh, by the way, when you're not doing infection control, can you just manage the data center? You need to recognize that data is, if anything, escalating. It's not diminishing. I used to joke and say, your Dr. Google has way more information than my medical degrees. I just have context. But now with large learning models and ChatGPT and everything else, the adaptive nature of technology is significantly different. So if I was going to give one perspective, I would say you need to bring into the organization people who are data and technology driven, specialists and focused. It's their day job to do that, while the clinician and healthcare practitioner's day job is to provide care. What I do see happening is there's a blurring of lines. You should have a chief information security officer. You should have a dedicated team focusing on technology architecture and safety. If you don't, you're not a mature organization and you're significantly at risk.
Yeah. Wow. Thank you so much, Brad and Prinesh. I think you have been really, really amazing panelists. As we come to a round off, I just want to quickly, remind, most of our participants here and say, look, the World Health Organization estimates that about 10% of the global health spending is lost to corruption, including data breaches and unauthorized use of healthcare data. So I think this for us is a very paramount and an important conversation that is epic. We really want to drive not only with our members, but with all our partners. And again, I want to say big kudos to you, both Prinesh and then Brad, for sharing some valuable knowledge. Now, I just wanted to bring to your attention that we are not stopping here. We do have more in store, particularly in relation to this. And in the month of May and June, I would probably ask my colleagues just to share a little bit of some of the slides that we have for our members who are part of EPiC. And I would definitely encourage you, if you are not registered as part of EPiC, please make sure that you use that QR code to register your organization so that you can get some of the conversations and some of the things that we have available and resources that we have for our members. So we actually are going to be holding workshops in which Brad and Prinesh are actually going to be, leading those as well on behalf of EPiC, particularly in relation to safeguarding information and use of data responsibly. We are going to have one in May and another one in June. Of course, that will be a Spanish one. And the first one is really going to be a 2 half-day sessions, pretty much focused on the senior leaderships and executives. It's going to be an online workshop. And it's available to all our members for no charge or fee. And really, in there, we are really going to be looking at speaking in more detail to some of the things here, right? The fundamentals of data security in healthcare, common information security challenges and risks, and how to help you develop the systems and policies that safeguard to address these challenges, and come and bring to fore some of the real world examples. So we definitely encourage you to attend. And someone will be saying, why should I attend, right? Firstly, to understand some of the key principles and practice of responsible data use and secure data management, and be able to assess your organization's data protection readiness. And of course, as part of these days, there's going to be a certificate for participation. I know, Brad, you are going to be, part of these. Do you want to add a bit of more color as well on what participants should expect here?
Thanks, Sylvan. I'd love to. Look, I think as we go into the longer sessions, there we're going to look not only at the theory like we've discussed tonight in the very short space of time, but what are some practical tools that you can start to use?
Yeah.
How would you do a self-assessment? How would you consider maturity? How would you look at implementing a stronger approach to safeguarding information? And then also some of the detail that both Pranesh and I spoke about around HIPAA or GDPR or different policies.
Yeah.
You'll have more detail on those so that you can then take that and apply that into your unique health system in the best way that works for you. Absolutely.
Thank you. And in fact, whilst we have one that is focused with the senior leadership and executive, and these are going to be longer ones, we do also have, a second cohort of similar workshops, which are going to be a little shorter, right? And I'll ask my colleagues to go to that so that we can give you the detail. And these really short 90 minutes, and we are really going to be focusing as well on some of the hospital frontline stuff. Now, not to say I'm not precluded from attending the first one. You could if you probably fit in that bucket, but we have decided to have one that's a little bit more compressed, focus on the hospital frontline staff who might not have time to attend to full day sessions. And again, similar to the other one, the importance of cybersecurity and secure management, the responsibilities of some of the key frontline staff, I think are going to be brought up here. And I know, Prinesh, you having been a practitioner, you're of course going to be playing a major role as well on this particular one. Do you want to just share a bit of color? Then of course we'll be rounding off in a minute.
Thanks, Sylvan. I think this is that important kind of element for people on the front line and dealing with patient care every day, where healthcare data and security has become a part of your daily job now. And I think really what we're trying to get out of this is it's enabling and empowering people to feel comfortable discussing this with patients, as well as understanding how it's involved in your daily life. And at the same time, as we mentioned, it's really increasing awareness about the importance of cybersecurity and patient data management in your day-to-day job and carrying out day-to-day activities within clinical care. So looking forward to it, and the practical aspects of this and what it means beyond the theory is what we're really hoping to bring forward.
Yeah, no, thank you again, both Brad and Prinesh, and all our participants, some who have stayed late. It's evening in some places, so we really want to say thank you so much. And those that are in the afternoon, please have a great rest of your day. But really, in conclusion, I think the key takeaway for me is to say, look, we must strike a delicate balance between innovation and responsibility, and harnessing that power of data while upholding the highest ethical standards, I think is one of the things that really has to be our greatest motivator. So let me once more thank you so much for joining today, and to our secretariat who are working behind the scenes. Thank you as well for facilitating this. And I want to encourage you, if you want to be part of this workshop, please make sure that you take note of that QR code, or go to the EPiC website, become a member, and of course you can have access to all these and many other resources all at your doorstep for no additional charges, as you'd know. So from myself and the rest of the panelists, I wanted to say thank you so much and have a great rest of your